explain procedure of the LSCS. First we have to explain the procedure to the patient and relatives. Take the consent. After taking the consent, we need to clean the private part and surgical part, lower abdomen. After cleaning everything finished, we have to put the Foley's catheter. Foley's catheter is very must. After putting the Foley's catheter, we are transferring the patient from delivery room to OR. After transfer the patient, operation theater, we are making the patient supine position. We are connecting the monitor. We are checking the vitals. If everything is okay, we are going for the sedation part. That means anesthesia. According to the patient condition, they are giving spinal anesthesia or general anesthesia. Mostly they are giving the spinal anesthesia. Once the spinal anesthesia given, we are starting the procedure. How we are starting? First we are starting with the cleaning. How we are cleaning? With the betadine. We are putting the betadine inside. Use of the gauze and sponge holder, we are doing the cleaning. After cleaning, we are doing the draping. What is the meaning of draping? We are expose only the surgical part. So after draping, the doctor starting surgery. How they are starting? They are making the incision with the use of the 20 blade or 22 blade. After incision, they are using one by one instruments. Okay. After skin incision, we are going to the muscle incision. How they are doing? With the help of the blade, they are doing the muscle incision. Once it is completed, we are going to the rectus sheath incision. How they are doing? With the help of the tooth forceps and curved scissor, they are doing the rectus sheath opening. Once it's opened, they are doing the retraction of the rectus sheath. With the help of the both hand, they are doing the retraction of the rectus sheath. After finishing this one, we are going to the abdominal cavity. Once we are entering into the abdominal cavity, we are putting the Doyne's retractor. Why we are putting Doyne's retractor means, when we are putting this one, we can see the internal cavity very clearly. At the same time, we are giving support to the bladder to prevent injury. After putting Doyne's, we are opening the peritoneum. How we are opening the peritoneum? With the use of the non-tooth forceps and curved scissor. Once it's completed, then we are going to the uterine wall incision. For that, they are using 22 blade or 20 blade to make a small incision. Once they are make the small incision, again they will do the extension. After opening of uterine wall, we are seeing the amniotic sac. How we are opening the amniotic sac? With the use of the non-tooth forceps or tooth forceps. Some doctors using the curved scissor, some doctor using the blade. Once we are opening the amniotic fluid, we can see the fetus head. Then doctor trying to take manually the fetus head. From the assistant, they are giving the fundal pressure, then the fetus will come out. Once fetus come out, we are doing the cord clamping and cutting. How we are doing? With the use of the two curved artery or two straight artery we are using. Then we are doing the clamping both side, and in the middle we are cutting with the curved scissor or straight scissor. Once this cord clamping finished, we are going for the placenta removal. The doctor will do the placenta removal. After placenta removal, the doctor will do the cleaning of the uterus with the help of the mop. Once again, I will explain steps of incision. First, skin incision. Secondly, muscle incision. Third, rectus sheath incision. Fourth, peritoneum opening. Fifth, uterine wall incision. After uterine wall incision, we are doing amniotic sac opening, that is sixth one. Seventh, we are taking the baby out. And eighth, we are doing cord clamping and cutting. And ninth, we are removing the placenta removal. And 10th, we are cleaning the uterus. Now I am going to tell how they are doing closing of each incision. What type of the instruments they are using. What type of the suture material they are using. First, they will clean the uterus thoroughly. After that, they are catching the margin of the uterus. They will check any bleeding are coming. How they are catching the margin of the uterus? With the help of the Alice forceps they are catching. Once it is finished, they are starting the suturing. Here what type of suture they are using? 1 vicryl or 10 vicryl they are using, that is the absorb suture material. So once the uterus closing finished, the second one they are going for the peritoneum closing. For peritoneum closing, they are using the curved arteries. They are holding 4 edges with peritoneum artery. Then they are using the chromic catgut. 20 chromic catgut they are using for the closing of the peritoneum. Then they are closing the rectus sheath. For rectus sheath closing, we are using Alice forceps. How we are holding? We are holding the edges of the sheath. And for that, we are using 1 vicryl. This is absorb suture material. Then they will close the muscle. So here also some doctors they will use vicryl, some doctors they will use the chromic. According to their practice they are using the vicryl or chromic catgut suture. After finishing everything, they are come to the skin closing. Skin closing they are using absorb suture or non-absorb suture. If it is absorb suture means they are using the vicryl. If it is non-absorb suture, they are using monocryl or prolene or ethylene. Some doctors using skin stapler for the skin closing. This is the simple step how they are doing suturing for the uterus, the secondly peritoneum, and third rectus and muscle, and finally skin. For easy remember, I will tell simple trick. When we are starting the procedure, we are start with the skin incision, end with the uterus incision. After finishing the procedure, once baby come out, we are start with the uterus closing and end with the skin closing. After finishing procedure, what to do? What kind of activities as a nurse we have to do? We have to check the patient, monitor thoroughly during procedure, before procedure and after procedure also. If vital everything normal, then we are moving the patient to the post-operative room. Once we are shifting the patient to the post-operative room, they also connecting the IV fluid, they are also monitoring the vitals. If everything is okay, the patient is conscious, the patient is stable, the urine output is normal, then only we are shifting the patient post-operative room to again the ward. So this is the simple explanation of the LSCS procedure. First I explained LSCS instruments, their purpose and preparation for the procedure, and finally I explained the steps of the LSCS.